name is Abby. I'll be a nurse practitioner examining you today. Do you have any complaints?
No.
No? Okay, so first I'll start by some orientation questions. Do you know where you are?
The clinic,
Okay, do you know the year?
2018.
And what about the month?
February,
And who's the president?
Donald Trump.
Okay, good. So I can say that she is alert and oriented at this time. She appears to be in good hygiene. She's dressed appropriately. She doesn't seem to be in any distress or trauma is noted at this point. So first I'm going to start with inspecting her skull. So her skull is normocephalic. There's no trauma, there's no masses, her hair is normal distribution. Her face appears to be symmetrical as well. Her eyes are symmetrical, nose, lips, and mouth, and her mouth movements and her ears are also in line. I'll inspect her skin. Her skin is normal color for her ethnicity. Everything seems to be intact. Her nails are well groomed and they're pink, and her capillary refill is less than 3 seconds. Her skin turgor is also good. So then I will go on to look at her eyes. So her scleras are white, conjunctivas are clear, there's no yellow tint. I'm going to test your peripheral vision at this point. So tell me when you can't see my fingers anymore.
Okay.
Okay, so that is good as well. I'm going to test your confrontation, so just cover one of your eyes. And let me know what numbers I'm holding at.
1, 2, 3.
Okay, now switch eyes.
1, 2, 3.
Okay, and now I'll test your 6 cardinal fields. Follow my finger with just your eyes. Okay, so now I'm going to look into your eyes. So just look at a point right behind me. So the red reflex is noted, the optic disc is white. Perla is intact, the corneal light reflex is also intact. Okay, now I'm going to look at her ears. I'll palpate her auricles and her tragus. On both sides, they're the same. There's no masses or trauma noted. I'll look into her ears. Is there any tenderness? Okay. First, I'll start with this ear. Her tympanic membrane is pearly gray. The cone of white is in the appropriate place. And it's clean and clear. I'll also look into her nose at this point. So her turbinates on both sides are pink and moist. There's no deviation or obstructions. Both hairs are pink. I'll look into your mouth. Can you say ah? Okay, her uvula moves with phonation. Her tongue is pink and moist. All her mucous membranes are moist. Lips are pink. All her teeth are clean and the same on both sides. Now I'll look at her neck. Can you also move your jaw open and closed at this point? So there's no crepitus, jaw moves freely. Her neck is symmetrical, there's no masses felt. I can palpate her lymph nodes at this point. Any tenderness?
Mm-mm.
And there's no swelling. Okay, so her thyroid, swallow for me. Thyroid moves with swallowing, her trachea is midline, and there's no masses felt. I will palpate her carotids. And then I can also listen to her carotid artery on both sides. These are normal rate and rhythm. And I'll just go ahead and listen to her breath sounds. Anterior and posteriorly. At this angle, I can see that there is no jugular venous distension. I can listen to her heart sounds at this point. So the aortic, the pulmonic, the second pulmonic, the tricuspid, and the mitral. And now I'll palpate. So I'll palpate her precordium. I'm going to look and make sure the AP diameter is 1 to 2. Her chest expansion is equal on both sides, and there's no distress. And then I will assess for tactile fremitus. Can you say 99?
99, 99, 99,
I'll percuss. And then I can test for CBA tenderness at this point too. Is this any tenderness noted?
no,
All right, so then I can say that there was no heaves or thrills with any of the precordium or when I palpated the PMI. I will also grade her arteries. I'll do the radial. I already tested the carotid. I can test her femoral, her brachial, and then popliteal. And there's no heaves or thrills. The pulses are regular rate and rhythm, and they're symmetrical on both sides. Now I'll assess your abdomen, so I'll have you lay down. So I can say her abdomen is flat, it's symmetrical, there's nothing noted just on just looking as inspection at this point. I can listen to her bowel sounds. Okay, and then I'm also going to go back and listen to her cardiac sounds at this point. So I will listen to, as I did would have before, 60 seconds at each point with the bell and the diaphragm. Sitting, laying down, and then also in the left lateral recumbent position. And I'll have you lay on your left lateral side. Then I would auscultate again. Okay, so back to your abdomen. I'll have you lay on your back. So now I'll listen to your aortic artery, your renal, and your iliac, and then your femoral. And those are regular rate and rhythm. Okay. So now I can palpate your abdomen. I would do light palpation first to assess for any masses or tenderness. Any tenderness noted?
No.
Okay. And then I would also do deep palpation. And percussion at this point as well. All right. Now I will assess for any lower abdominal pain. I'll first test your McBurney's point. Any pain there?
no,
Okay. And now we'll do your psoas sign. So I'll have you flex your knee and your hip. Perfect. And I'll push that inward. Any pain there?
no,
Okay. And then I will do the Rothsing sign. Any pain here?
mm-mm,
Okay. And then any pain with this?
no,
Okay. So I tested the McBurney's, the psoas, the Rothsing, and the obturator to test for any appendicitis related pain. And she doesn't have any of those at this point. I can also test the McMurray sign to assess for any gallbladder pain. So I'm going to have you take a deep breath. Any pain with that?
no,
Okay. And then I can palpate for the spleen. And the spleen's not noted. And then I would palpate for the liver edges. And that's about 7 centimeters. Lastly, I could feel for the inguinal lymph nodes, and I don't feel any there. So with the abdomen, I haven't felt any abnormalities, no masses, no pain, no tenderness. So then I would move on to her cranial nerve assessment. So I can have you sit up at this point. All right, so I can test cranial nerve number 1 by assessing for her smell. I would ask her to tell me what she's smelling, and if she was able to say it, then her olfactory nerve number 1 would be intact. Then I would test her optic nerve number 2. We did that with confrontation, visual fields, and then I can also use the Snellen test at this point. And I would have her read the lowest line that she could, and that would tell me her visual acuity. She would do it covering one eye at a time. Then I would test 3, 4, and 6, which is the 6 cardinal fields of vision, which we have already done. And I can say that those were intact when we did those. So then I would do cranial nerve 5 and 7. So I'm going to have you clench your jaw, smile, puff out your cheeks, close your eyes really tight. Okay, and all of that is intact and the movement is all symmetrical. Then I would test cranial nerve number 8, which is the Weber, Rhine, and whisper test. So I would do the whisper test by having you cover one of your ears and tell me what I'm saying.
Apple.
Okay, and then cover your other ear.
Orange.
Okay, good. So that's intact. I would then do the Weber and Rhine test. Can you hear it the same in both ears?
Mm-hmm.
Okay. And then just tell me when the ringing stops.
Okay. Okay.
Okay, so cranial nerve 8 is intact. I would test 9 and 10 by having her open her mouth. I'll use a tongue blade to test her gag reflex, and that's intact. I can have her swallow, and then I can say her speech has been regular rate and rhythm, which also assesses 9 and 10. I can do 12 at this point. I'll have you stick out your tongue, move it side to side, up and down. Perfect. That one is intact. And then for cranial nerve 11, I'll have you shrug your shoulders and then move your head side to side. Perfect. Good. So all of those so far have been intact. I'd like to go back and just make sure that revisiting 5 and 7. Tell me if this is sharp or dull.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay, good. So those are intact. So her cranial nerve assessment was normal. Then I would have her hold out her hand, and I'm going to put this in her hand, and I'm going to ask her to tell me what she's holding.
A card.
Okay, and then your other hand.
A card.
And this is a sternognosis test. And then I would have you hold out your hands and tell me what number I'm writing.
2. 3.
Okay, so from those, the graphesthesia, and then the other one, her somatosensory pathways are intact. I'll have you walk for me, just heel to toe, just take a few steps here. And this is the Romberg test. And this is normal as well. She's not swaying, balance is good, and she's able to walk heel to toe. At this point, I can inspect her spine. It's straight, there's no masses. Is there any pain?
Mm-mm.
Okay. And then her posture is symmetrical on both sides as well. I'll have you sit down. Then I will have you take one finger, touch your nose, and then touch my finger. Okay, and switch. Perfect. And then I would test her grip strength, and then push, and then pull me. Perfect, and that's really strong. 5 out of 5 as well on that. I will also have you take your foot and go heel to shin. Perfect. On the other side. Okay. And she's able to perform that as well. Then I would inspect her Babinski sign, so I'll have you lay all the way down for me. Without her shoes on, I would be able to tell her Babinski reflex, and that would be negative. Okay. Now I'm going to test the strength and coordination of her upper extremities. I will have you abduct them, or adduct them, so put them abduct, go up, and then adduct, go down. Perfect. Flexion, and then extension, hyperextension, and then supination, and pronation. Perfect. So those are strong and those are intact, and the movement is the same on both sides, no jerky motions. And then I'll test her knee strength. Push out. Perfect. both of her legs are very strong, and I'll assess her knees. They feel the same on both sides. Any pain?
No.
Okay. When she was standing up, or actually I'll have you stand up one more time. When she stands up, her feet and legs are straight. There's no varus, valgus, or vagus. Okay, so I'll have you sit back down, and I'm gonna test her drawer and Lachman's. I'll have you put your knee up. Any pain?
No.